Hello, everyone. I'm Anna from the International Federation of Medical Student Associations. First of all, I would like to thank you for the opportunity to speak today on behalf of IFMSA, representing over 1.5 million medical students worldwide. Sepsis takes over 13 million lives each year, but behind this number are mothers, children, and patients whose life could have been saved. For us, as young people and future healthcare providers, this is not just a health issue, it's a matter of justice, equity, and urgency. So we strongly support the 2030 Global Agenda for Sepsis. However, as youth, we're not just observers or beneficiaries of this agenda. We're implementers, advocates, researchers, and educators. But let's take things from the beginning. Sometimes we're scared to talk about sepsis, so we avoid it at the hospital, with peers, with patients. But we have to talk about it so we can change the situation. Why? Let me share with you some stories from our archive. Watching patients die from operative wound infections and systemic sepsis because the only antibiotic was pyrometronidazole was difficult to comprehend in its entirety. Undoubtedly, these deaths should have been prevented. As medical students, we come face to face with the consequences of young people who face barriers to their sexual and reproductive health rights. We come to realize that these stories are not just particular to our own countries, but many other parts of the world. We therefore need to tell more of these stories with one voice. With the youth have the voice and the required medium to proceed echoes in every part of the world. The young girl I found unconscious in the obstetrics and gynecology ward 2 weeks ago cannot tell her story of how her perforated uterus led to sepsis and death following an unsafe abortion. We need to tell her story for her and the stories of so many other young people just like us who are suffering in silence. Let us tell these stories and let us tell them so loud that our leaders out there will have no choice but to listen. Youth are already leading the change. Across the globe, medical students are working to reduce the burden of sepsis, not just in theory, but in action. Students raise awareness through campaigns and do fundraising to support the hospital equipment. They share sterile kits and they involve in research. We're also engaging through our professional exchanges, where students rotate through hospitals worldwide, many of them in emergency and intensive care units, learning about sepsis management and witnessing firsthand how system preparedness, or the lack of it, saves patients' outcomes. We also advocate for sepsis through various policy documents, including access to medicines, safe surgery and anesthesia, and reproductive health. And yet, sepsis remains underrepresented in many medical curricula. This is why IFMSA advocates for better training in early recognition, maternal and neonatal sepsis, and infection control. But we know that education is only part of the solution. Innovation matters too. We also have a unique perspective and role in innovation. We're born in the digital age, so we understand how technology can be used for outreach, monitoring, and education. Whether it's using AI to support triage, building mobile apps to track vital signs, or designing decision support tools for rural health workers, young people are ready to contribute to solutions. But innovation without inclusion won't save lives. We need investment in digital tools that are affordable, scalable, and ethical, especially in low resource settings. And as we talk about the future of sepsis, let's be clear. It's not about just producing more medicine or devices. It's about building resilient systems, locally led and responsive to community needs. This means ensuring youth from all regions, and especially low and middle-income countries, have access to training, monitoring, and funding to participate in sepsis research and implementation. We need governments and donors to invest in digital infrastructure, early diagnostics, and manufacturing capacity so that sepsis is timely and locally accessible. Finally, we must use our voices and work with patient organizations. We may not have decades of experience, but we bring passion, innovation, and a lived connection to our communities. With the right tools, platforms, and partnerships, We are ready to help lead this transformation. Let's build a future where no one dies from a preventable infection, because awareness, care, and action were there in time. Thank you so much.